Hey, good evening. Welcome aboard. Thanks for jumping on. My name is Heather Flexer. I'm a doctor of physical therapy, a certified wound specialist. Better Wounds is my baby, and twice a month I'm going to go live and talk directly to patients or clinicians and answer questions that you might have. And right now we're talking about infection. Does this look okay? That's probably one of the most common questions you're going to get if you're looking at wounds, or if you have a wound, like, is this all right? I can't really tell. That's really common. I've been in that situation myself. I was actually on Facebook earlier today, and there was a woman who had some abdominal surgery. I don't know if it was, I think it was plastic surgery, and she had an incision, and the stitches didn't come out. One got left in, and she developed an infection, turned into a tunneling thing. And ultimately it took 4 or 5 months to heal, which is just crazy and super unfortunate. And so if I can help someone by talking about this kind of stuff and you find me, and that's great. That's what this is all about. So feel free, if you're jumping on here live, let me know you're here. If you hit the replay, go ahead and let me know you got the replay. Drop a comment or a like, say hashtag replay. So we're talking about infections. If you have an incision, you get a cut, you're at home, you're trying to figure it out, there may be a point where you're not sure if it looks okay or not. So let's do a little review. So it is totally normal for the first couple of days for your skin to be a little inflamed, a little red, a little swollen. All of that's pretty normal. You can use ice and elevation. Those are typical recommendations that you're going to hear from your healthcare provider. Ice it, keep it up over your heart. That's all fine. If you're going to use anything like an ACE bandage or anything like that, always make sure you're starting from far away and moving up towards the heart. You don't want to like start an ACE like kind of in the middle and then all of this swelling happens in your hand. So you want to be really careful about that. So what you want to do is really monitor, is it getting better, worse, or the same? If it's getting better after the first couple of days, you're probably fine. If it is 5 days in and you still have a lot of pain and a lot of swelling, we might have a little bit of a problem. I would circle back to those initial recommendations of elevating and icing and keeping it dressed and covered and all that stuff. So if you're not really sure if it's getting better, worse, or the same, then what you can do, of course, you should be talking to your healthcare provider. Whoever made the incision, you should be able to get in touch with their office and let them know, like, hey, I don't know if this is okay or not. Usually they'll get on the phone with you. I'm always available as well. If you find me and we're involved, I do consultations as well. But what you can do is make it objective. So you are going to, you can take something like a tape measure and go ahead and measure, right? So if you've got an incision, you want to measure around bony landmarks. So if you're not really sure if the swelling is going away, it's hard to do on yourself. You can always have someone else do it, but we usually take measurements in centimeters. You can always use a tape measure to go ahead and take your measurements. If you're the healthcare provider and someone's complaining about prolonged swelling, you should be taking girth measurements, and you want to do it around bony landmarks. So around the ankle joint, around the knee joint, fingers, whatever. That's just going to help, give you an objective measurement. So that's fantastic. Definitely keep in mind, if you've got things like poor circulation, coronary artery disease, peripheral artery disease, or diabetes, lymphedema, neuropathies, that's going to make it harder to tell. So you are going to need to take these objective measurements. So that's a good way to just get an eyeball on if it's getting better, worse, or the same. if we're talking about the incision site and it's getting red and you can't really tell if it's red or, take a picture. That's great. That's objective. Or you'll also see sometimes the nurses will take a Sharpie and draw a line where the redness is. That is great as well. If the redness starts to spread outside the borders of the Sharpie, then you know that it is getting worse. So make it objective. I know it's kind of gross, but I've given myself an infection by biting cuticles before. And one way I could definitely tell it was not getting any better, because I couldn't really tell, is this better or worse, was that I couldn't bend the joints. So look toward the joint that's closest and see if you can bend. That's a good objective measurement as well. So pain is pretty subjective, but we're doing 0 to 10, better, worse, or the same. That's going to be up to you to really determine, is this getting better, worse, or the same? So just checking my notes. Drainage. We've talked about this before too. Drainage should always be getting less as the wound is healing. If it spikes at all and there's like a ton of drainage coming out, if an incision busts open and there's drainage coming out, that's a big problem. That was that woman on Facebook. That was how she knew there was a problem. Her stitches popped open. So clear fluid is usually okay. If it's thick, green, yellow, pussy, green, smelly, all that's not good. That is an infection. You want to catch these things when they are pretty superficial in the superficial tissues. So if that is happening, if your incision opens and there is smelly stuff coming out, you need to call your doc. You need to make sure that they know what's going on. You're probably going to need some antibiotics. But if you're a DIY person like my husband, you need to be careful. That is not something you really want to mess around with, especially if you have any implanted devices inside your body. If you've got a total knee, if you've got breast implants, screws, anything like that, you definitely want to be in touch with your doc. This is not a DIY situation. You've got devices that, if an infection goes deep in there, then you're looking at needing to get explanted, and that's like the worst thing ever. So let's not mess around with that stuff. Let's see. So if your incision pops open, sometimes it's not like the whole thing, it's just like a portion of it. There's a little opening. Probably one of the things I've seen the most online is that the stitches open up and the person who it happens to goes to their doctor and they're just told to like cover it. And that's kind of a shame. So wounds need, if there's any dead space in there, empty space, open space, that needs to be filled with some packing. And we can definitely feel free to touch base with me if you see this, or share this out with someone you know that is dealing with something like this at home. But gauze is probably one of the oldest dressings, and that's why it gets recommended so much, but really doesn't help heal healthy tissue. It can actually sometimes cause some harm, but I think that's sometimes why some of these wounds stay open too long, and that's something I really want to help people avoid. There's much better stuff on the market besides gauze, things that are readily available. It's super tough if you're just Googling and Amazoning and stuff like that if you don't really know what you're talking about. So feel free to reach out if you're dealing with an open area. But negative space needs to be filled. It shouldn't be just covered. If they're not going to stitch it back up, then, and your doctor is just telling you that it's going to be okay, just keep it covered, you probably want to get a second opinion. So that's just my 2 cents there. But if a wound is not really changing within 2 weeks, like you have that, your incision opened up and that depth hasn't really changed, it's not really closing, and it's like 2 weeks later, then it's definitely time for a treatment change. So you want to be doing something different. And if your surgeon isn't going to give you new recommendations, and maybe look into a local wound center or feel free to reach out. I'm happy to discuss things with people. Any last things? Yep. So if you catch this, I would love to hear what you might want to hear a little bit more about as far as incision care, any questions that you have. Go ahead and post them below. I would really love to get some feedback and see what direction I should take this live in, but I look forward to all the comments. I really enjoy interacting with all of you out there, and I'm happy to help. So go ahead and reach this. I'll be back in 2 weeks with another comment. Hi, Andrea. And, you know, if you catch this on the replay, hit hashtag replay, drop a comment, drop a like, drop a love, drop a share. I appreciate it. It helps get it out to more people. And I will be back in 2 weeks and we'll talk about something else. So I'll go ahead and post that topic up and we'll see where this goes. I love you guys. Thanks. Bye.